Anyone who has spent days in bed knows how uncomfortable it can be. Daily activities that were taken for granted are no longer possible. A person's world becomes limited to one room and the interactions that take place there. As a caregiver for someone on bed rest, you will be the person he or she interacts with most. What can you bring to that room to enhance the environment? In this program, you will learn how to make the experience more pleasant for you and the person confined to bed. You'll also learn the essential skills required when caring for someone on bed rest and how to perform the procedures safely. A hospital bed is very helpful for someone on extended bed rest. The entire bed can be raised to make it easier and safer when providing care. The head and knees of the bed can be raised for comfort and a change of position. When a person is on bed rest, it's important to keep the room clean and free of clutter. Provide colorful touches such as paintings, flowers, or interesting objects. Make sure that reading material or music that the person enjoys are available and nearby. This attention to atmosphere and cleanliness helps to create a more pleasant and enjoyable experience. For someone on extended bed rest, consider moving him to the living room where he can be part of the family's activities. Caring for someone on bed rest requires physical activity, such as lifting, reaching, and bending. Using proper body mechanics reduces the risk of injury because then your body is positioned correctly for the activity you are performing. Avoid lifting whenever possible. Instead, slide, roll, or push. If you must lift, know the maximum amount of weight that you can lift and move safely. Before lifting, create a strong base of support by widening your stance so that your feet are about shoulder width apart. Hold your chest up and your head erect. Bend at your knees and hips, not at your waist. Bring the object close to your body. Tighten your stomach and buttocks muscles and lift with your leg muscles, not your back. Always lift in a smooth motion to prevent injury. Never twist at the waist when moving an object or person. Instead, take small steps and turn your entire body in the direction you want to face. A pressure ulcer is a wound that develops from excessive pressure to the skin. It typically occurs at points on the body where the bone is close to the skin, such as the back of the head, shoulder blades, heels, elbows, hip joints, and tailbone. These areas are called pressure points. Pressure to these bony parts of the body causes a restriction of blood flow to the tissue and loss of oxygen, causing tissue destruction. If left untreated, pressure ulcers can cause infection not only at the site, but also throughout the entire body. They can be fatal. The seriousness of a pressure ulcer is not determined by its depth alone. A 1/8 inch ulcer on the heel or elbow is a very serious pressure ulcer because it is so near the bone. Compare it to an ulcer on a more fleshy part of the body, such as the hip. People who are confined to a bed or wheelchair, who are unable to move themselves, and who have lost feeling in parts of their body are at a very high risk for developing pressure ulcers. The caregiver must move and position the person in order to give parts of the body relief from pressure.
The important thing in preventing pressure ulcers is to think about distributing weight. The problem with a pressure ulcer is if someone is lying on their back and their feet and their heel actually is lying on the bed, the complete pressure of their foot is right on their heel. The important thing is not that they can't put any weight on their heel, but you should distribute the pressure so that it's distributed all the way across the leg, across the ankle, across the heel, so that no one spot is receiving the pressure. So no matter how you're positioning someone, the important thing is to stop, look at the way that they're lying, and notice what seems to be receiving points of pressure. And then you want to try to distribute that pressure. So for instance, if someone is lying on their side, you might use pillows in a way to separate their knees so that their knees, which have two bony spots together, aren't lying together, but you have a pillow between their knees. You might put a pillow behind their back so that they're not lying fully over on their hip, but they're rolled just a little bit towards their back so that the pressure is distributed all the way across their back.
Never drag the person's skin along the sheet during a move. Dragging causes friction, which can cause skin breakdown on an area that is prone to a pressure ulcer. A draw sheet can help prevent friction to the skin. A draw sheet is an additional sheet folded lengthwise and placed in the middle third of the bed under the person's torso and buttocks. A draw sheet is used to slide the person into a new position. Check the skin daily, especially the pressure points. Bath time is the best time to examine the skin with minimum discomfort.
Anytime you're sitting for a long time, you've probably noticed that you'll end up with a red spot. Well, you or I or anyone else, that red spot will go away within 5 minutes or so. But someone who is developing a pressure sore, the first thing that you'll notice is that that site becomes red, and you can see the redness. Now, if you're really aware, actually what you will notice is that it can often become warm first before it actually starts becoming red. So any spot that you're concerned might develop a pressure sore, as soon as you turn the person off of that site, put your hand gently there and feel it. And if it's starting to feel very warm to you, that's actually the first sign that a problem is developing. The second sign is that it will stay red for about 30 minutes, rather than staying red for only 5 minutes. Pressure ulcers then will progress to where they become an open wound. And that open wound may start with just red-looking tissue. It may be brown, it may be white, it may be black. But again, all of us know what normal-looking skin looks like. As soon as you see something that no longer looks normal to you, that's the time to call someone and ask them to take a look at that site.
Avoid using deodorant soaps. Instead, use a mild or no-rinse soap. Use warm rather than hot water when bathing. Keep the skin clean and dry. Prolonged moisture can weaken the skin. Change moisture-absorbing pads and briefs frequently. Do not massage pressure points or reddened areas. Clothing should fit comfortably, not too loose or tight. Bed sheets should be clean, dry, and free of wrinkles. Wrinkles cause unnecessary pressure on the skin. Avoid using plastic sheets. Follow up on complaints of pain, burning, or tingling of the skin. This could be an indication of a pressure ulcer. Heel and elbow protectors can help to relieve pressure on the skin. Don't rely entirely on the device. Always check the skin to be sure the device is actually helping to relieve pressure. Anyone on 24-hour bed rest should be on a pressure-relieving mattress. Your nurse or home medical supplier can help you select appropriate pressure-relieving products. Never attempt to treat a pressure ulcer yourself without first consulting trained medical personnel. The 4 basic bed rest positions are supine or back lying, lateral or side lying, Fowler's, a semi-sitting position, and prone or abdominal position. In the supine or back-lying position, the head should be in line with the body. To keep the head properly aligned, use a pillow that extends from the lower neck to the head. The knees are bent and supported by a pillow. This helps to relieve stress on the lower back. Pillows can help to support the arms and hands if needed. Other devices can be used to help support the body and keep it in good alignment. A foot support is used to keep the feet in an upright position. Use padded rolls or rolled washcloths to keep the fingers in a slightly flexed position and help prevent contracture. A contracture occurs when the muscles become inflexible, causing the hand to curl into tight locked fists. Hand splints keep the joints of the hand and wrist in the proper position. Lateral or side-lying position helps relieve pressure on the lower back. It is the best position for someone with swallowing difficulties. Support the head with a small pillow. The arm under the body is in front of the chest bent upward at approximately a 90-degree angle. Support the upper arm and hand with a pillow. The upper arm should be kept in a bent position close to the body. A large pillow between the legs supports the entire top leg, including the ankle. This position can cause impaired circulation of the arm that is under the body. Reposition the person if he or she complains of numbness, pain, or tingling, if the arm is cool or discolored, or if the fingernails are blue. If lying directly on the hip bone is painful, you can use a modified lateral position by rotating the pelvis 1 or 2 inches toward a back-lying position. This keeps the weight off the hip bone. In this position, the weight is between the hip bone and the lower back. In the Fowler's or sitting position, the head of the bed is raised 45 to 60 degrees. The hips are at the downward bend of the mattress. Support the head with a pillow. Use pillows to support the arms and hands if needed. The knees are bent and raised. To eliminate pressure on the heels, place a thin pad or pillow under the legs from the mid-calf to the ankle. This will distribute the pressure and raise the heel slightly off the bed. Fowler's position increases the pressure on the base of the spine. To relieve pressure, lower the head of the bed to 30 degrees to modify the position. The prone position relieves pressure to the back. Do not use this position if the person has cardiac disorder, respiratory distress, recent abdominal surgery, or if the person complains of discomfort. The head is turned to the side, resting on a flat pillow or towel. The arms are at the sides or bent at the elbows toward the head. A small pillow or folded towel placed under the abdomen may increase comfort. A pillow is placed from the knees to the ankles so that the feet are in a flexed position. The feet can also hang over the edge of the bed. Support the ankle by placing a folded towel beneath it. Both positions help keep pressure off the toes and ankles. Sims position is a combination of the prone and side-lying position. This position relieves strain and pressure on the lower back. From the prone position, move the upper leg toward the chest. The opposite arm is behind and along the body. A flat pillow or towel can be placed under the knee, ankle, shoulder, or abdomen if this provides added comfort. Before providing care, always wash your hands to prevent the spread of germs. Wear gloves if there is a chance of coming in contact with body fluids such as sputum, feces, urine, or blood. Tell the person what you plan to do. He will be less anxious and more willing to cooperate if he knows what's going to happen beforehand. Let him know how he can assist you. Ask for his assistance and encourage him to do as much of the move himself as he can. Begin with the bed in a flat position and if possible raise it to a height that is level with your elbows. When working alone, move the person in sections, starting with the upper body. Stand with your feet shoulder-width apart, 1 foot in front of the other, knees bent and as close to the bed as possible. Slide one arm under the person's shoulder so that your hand reaches to the far shoulder, and slide your other arm underneath the middle of the back until your hand reaches to the far edge of the back. Keep your elbows as close to your body as possible. To support your back, tense your abdominal and buttocks muscles. Count to 3, and on the count of 3, bring the shoulders toward you, sliding your arms along the sheet as you shift your weight. Check to be sure that the head is in line with the spine. Move the middle body in a similar way. Slide one arm under the body at the hips and the other arm just below the buttocks. On the count of 3, bring the middle body toward you, sliding your arms along the sheet as you shift your weight. Then move the person's legs so that they line up with the rest of the body. When 2 people are available, one person moves the upper body while the other moves the lower body toward the edge of the bed. With the bed flat, begin to loosen the draw sheet on both sides of the mattress. Roll one side of the draw sheet against the person's body. Stand close to the side of the bed with your feet shoulder-width apart. Place 1 foot in front of the other and bend your knees. Grasp the roll sheet firmly with one hand at the person's shoulder and one hand at the hip. Begin to pull the person toward you, using your legs, not your back. If the person's weight is more than you can move at one time, then move him in sections. Begin at the shoulder and chest area, and then move the hip area. Check to be sure the head and legs are in line with the rest of the body. The bed should be flat with the person lying on her back. Remove the pillow from under her head and place it against the headboard to protect the head during the move. Ask her to help by bending her knees and bracing her feet and hands firmly on the bed. Stand with your feet about 12 inches apart. Slide one of your arms under the shoulders and the other arm underneath the buttocks. Ask her to lift her head and push with her feet and hands while you slide her toward the head of the bed. You can use several small upward moves rather than a single large one to reach the head of the bed. Replace the pillow under the head. Check to be sure that the head is in line with the spine. You will need 2 people when using a draw sheet to move someone to the head of the bed. Stand facing each other at opposite sides of the bed near the center of the draw sheet. Your feet should be shoulder width apart with your body turned slightly toward the head of the bed. Untuck the draw sheet from both sides of the mattress and roll the draw sheet close to the person's body. Grasp the rolled draw sheet at the shoulder area and slightly below the hips. Then bend your knees, keeping your back straight. Working together, count to 3, and on the count of 3, use the draw sheet to slide the person smoothly toward the head of the bed as you shift your weight. Replace the pillow under the head. Be sure to smooth the draw sheet until it is free of wrinkles. Tighten it and tuck it under the sides of the mattress. Begin with the person lying flat, close to the edge of the bed, with her knees bent. Bent knees will help reduce abdominal strain. Stand facing the head of the bed with your feet shoulder width apart. Tell her what you plan to do. Place your arm under her arm that is closest to you and brace your hand against the back of her shoulder. Ask her to put her arm under your arm and wrap it around your back, bracing her hand against the back of your shoulder. Slide your other arm under the neck and shoulders. When you're ready, count to 3, and on the count of 3, raise the head and shoulders as you shift your weight. Continue to support her in the locked arm position while you gently lower her down. Begin with the person lying on his back. Cross the leg that is farthest from you over the closer leg. Cross his arms over his chest. Place your right hand on his farthest shoulder and your other hand on the farthest hip. Stand as close to the bed as possible, feet shoulder width apart, and your knees slightly bent. Brace yourself against the side of the bed and gently roll him toward you as you shift your weight. Check the arm under the body. It should be in front of the chest. The elbow is bent upward at a 90-degree angle toward the head of the bed. Place a pillow in front of the chest to support the upper arm. Adjust the legs by bending the upper leg toward the chest. Support the entire upper leg, including the ankle, by placing 1 or more pillows between the legs. Support the back with a pillow. Check for good body alignment. The back should be straight and the head in line with the spine. Raise the rail on the side the person will be facing after the move. Begin with him on his back at the edge of the bed closest to you. Cross his arms over his chest. Cross the closer leg over the farther leg. Place your hand under his near shoulder and the other underneath his buttocks. Stand as close to the bed as possible. Then gently push him away from you, rolling him onto his side. A mechanical lifting device, such as the Hoyer lift, is most commonly used for those who cannot stand on their own, or whose weight makes it unsafe to move or lift manually. Remember that moving someone using a mechanical lift can create fear for some people.
And I think the biggest thing with that is to make sure that you're communicating with the patient during each of the steps, and that you're moving slowly while you're going through, and that of course that you're making sure that you explain to the patient what you're going to be doing. And these are all things that will help to make the process a little bit easier. And of course there's nothing more than practice makes perfect. Making sure that again that on the first time it may be a little unsettling, and kind of warn the patient ahead of time.
It is best to have 2 people when using a mechanical lift. In many care settings, it is a requirement that 2 people be present. Begin with the bed at a comfortable working height.
All right, we have a sling here, and we do want to make sure that the sling with the whole part is positioned down by the buttocks area. And let's go ahead and roll the patient this way. And then we're going to position this so it's about halfway underneath of the patient. You want to make sure that that hole is right in the buttocks area. And for a rule of thumb, you want to make sure that as far as at the bottom part of the sling is about knee to mid-thigh region, just so it doesn't slide out from underneath of the patient. Okay, now let's roll her back this way. And I'll finish pulling it out this side so we can get it well centered underneath of her. Okay, and then we'll roll her back to the middle. Okay, and let's kind of pull on both sides, make sure we're centered. Okay, now we have the chains to be able to hook up. It's important when you're doing these, you want to have the shorter chain go up to the front or the head of the patient, and you want to make sure that you have the hooks that they go out as far as away from the patient rather than toward the patient where they can gouge. Okay. And it's important to kind of think about that it's very unnerving when you're having, as far as a mechanical lifting a person. So it's one of those things you really have to be conscious that while you're doing these, that you're moving slowly, kind of letting the patient know what you want them to do to help. So let's position this in here now. We'll lower it down so we can hook up. At this point, you want to make sure the patient has their arms crossed across their chest so that they don't get in the way of the chains. Okay, she hooked that side up. I'll hook this side up. And as far as for our purposes, this depends a lot upon the debility of the patient, but a lot of times what I like to have done is I like to have the second person helping to support underneath of the patient's head just while they're being lifted up, because as far as that way it won't extend back and cause some damage to their neck. You also want to make sure that you are, as far as bringing those legs all the way out so you have full stability of that unit while you're moving the patient and lifting them. And you also want to go nice and slow so that you're not jerking the patient. Doing okay? Yes. And when you lift them up, you don't want to go clear up as high as the unit will go, because that just makes them more unstable. So you want to go just high enough so that their bottom is clearing the bed, and that way they're much more stable in that position rather than being dangling up in midair. And I think we're there. Okay, if you'll come around to this side. Again, in this instance, it's good as far as if the patient doesn't have any use at all of their legs, if the second person can kind of grab and help to stabilize while you're moving the patient off the bed toward the chair. And we'll move real slowly. It's important also to not move this any further than you need to with the patient in it, because that just gives you that much more chance to either, have something go wrong with the lift, or to, as far as be a lot tougher on you moving it, and then move the wheelchair underneath of it. And you do want to make certain that you are locking the wheelchair so it is stable. And let's go ahead and also what I like to be able to do is to grab on the sides of the sling so I can position her as far back into the chair and then kind of get her central in the chair. And you can even kind of let the chair come back just a little bit so that, again, they get their bottom all the way into the back of the chair. Okay, and if you'll go ahead and turn the knob just real slowly. And we want to have her go down nice and slow. Good positioning. Okay. Whoop, they can go nice and slow, stop right about there. And as far as we want to push this back a little bit, because as this comes down, as far as, can you go ahead and stop that knob? There you go. Because as this comes down, this can hit the patient in the head, so you want to make sure that this is pushed away from them. Some of them are not padded. This is a newer one, so it is padded, so it doesn't cause injury to the face or forehead of the patient. And then my job back here on the back is I'm going to kind of be positioning these things in so that they don't hook up on anything as you just gently lift on that. Whoops, go ahead. This is the pumper here. And as far as make sure that that knob is tight so that it will hold. And go up nice and slow. Okay, you ready to go up then, up out of the chair?
Yes.
Okay. All right, I'm going to again, okay, hold on just a second, Beth. Make sure. Okay, go up a little bit more. And this is kind of a narrow wheelchair because it's definitely, okay, keep going up. Doing okay?
Yes.
Okay, good. All right, okay, and that's good enough there. Okay, if you can hold her feet, I'm going to pull the wheelchair out. Okay, you doing all right?
Yes.
Okay, we're ready to move you. And just in the movement of this with weight in it, it's really not as easy as it appears. So you certainly want to make sure that you've got everything out of the way. And we're going to lift her up a little bit more because we want to get her just so she clears the height of the bed. Doing okay there?
Yes.
Okay. All right. And let's go ahead and go on in. And if you can grab here on these chains and just kind of pull her a little bit toward the center of the bed as we lower her. Okay, you all right?
Yes.
Okay. We're going to go down nice and slow.